Thank you very much. I'm delighted to be here and very honored to present and to share what are the key messages of the global report and how they can be relevant to persons with cerebral palsy and all the care providers and the caregivers who are dedicating time to improving the quality of life and to support persons living with cerebral palsy. I share a few slides. So the global report was produced by WHO and UNICEF, so I'm presenting on behalf of both organizations. I am just trying to change slide. The global report was developed in collaboration with many experts and persons with lived experience and advocates from across regions. And the aims of the report is to provide some key messages and a framework for action. And ultimately, we want to change the situation in terms of improving access to care and improving enabling environments, improving the world where persons with cerebral palsy grow up and live to make it a better place that is more enabling of better quality of life, development, and well-being and participation. The global report provides messages that can serve decision makers, policymakers, service planners, as well as other stakeholders, including young persons and organizations representing persons with lived experience. When we looked at the current situation and what we wanted to be improved for persons with developmental disabilities, we considered a whole of society approach. So what can be changed at the individual level, for instance, improving skills? What can be changed in the context that is near to the persons, including the families, the schools, and then broader in the community and the services? And then, more distal, what are the policies and how they can better align with international conventions on human rights? And the ultimate outcomes that we consider were development, given that the report is focusing on children and young people, but with a life course perspective in mind, health, well-being, and participation. I will share here some key messages, and then I'm really, pleased about the opportunity of hearing your voice and your perspectives. First, developmental disabilities are common. When I say developmental disabilities, we include a range of health conditions that cause a range of impairments in terms of motor communication, social skills, language, and this range of conditions that cause impairment are contributing to disabilities. And it is developmental disabilities because these conditions that contribute to disabilities are emerging during the developmental phase. And we define it as, in a broad sense, during childhood and adolescence. So this is a very broad group of conditions. Why are we talking about them together here? Is that when we consider what is the approach in terms of improving policies and services, we recognize that there is a lot of commonalities. It's similar to when we say, how can we improve systems for non-communicable conditions, for instance, and we keep together a range of conditions that we recognize are very diverse. They may require very specific interventions, but we can also talk about them in a common way to advocate for actions that can be undertaken broadly to support action that can improve access to care and environments for persons living with these heterogeneous, with these varied groups of health conditions. In this slide, there is a presentation of the global prevalence of this group of conditions based on data that was published, that was collected in 2019. And it demonstrates that developmental disabilities in children and young people are common. 7.5% of children less than 5 years of age and 14% of older adolescents have a health condition that contribute to the developmental disability. And, we estimate that 360.8 million children and adolescents have a health condition contributing to developmental disabilities globally. We also look at the 5 most prevalent conditions among those that contribute to the developmental disabilities. And you see that cerebral palsy is one of them. The prevalence in terms of global estimates range between 1.2 and 1.6 across these different age groups. So when we consider boys and girls together. And of course, when we consider prevalence rates, the numbers in individual countries, this may vary. And there are different reasons for that. It can be, how our capacity to count cases of persons living with cerebral palsy. And we recognize that, but this is a global estimate that consider all data provided by this global burden of disease study and across regions. A strong message emerging from the report is about inequalities in health. The fact that, yes, these health conditions, including cerebral palsy, are associated with a number of risks in terms of health. I give an example. I think, according to reviews of the evidence, in cerebral palsy, a person with cerebral palsy, according to estimates, is at higher risk of developing a mental health condition. However, we recognize that is not only the fact that the person is living with cerebral palsy that increase the risk to have an additional condition, mental health condition during adolescence. It is also a number of factors in the environments that contributes to the risk. For instance, adolescents with cerebral palsy are less likely to access mental health promotion interventions. They are more exposed to violence, to stigma, to discrimination, to exclusion. Their families may be more at risk for poverty. They might have less opportunities to access educations or to access sports and recreation and vocational initiatives. And all of these factors add to the risk and contribute to poor quality of health for persons living with cerebral palsy or other developmental conditions. There is an established additional, added risk or elevated risk for mental health conditions, for respiratory diseases, for type 2 diabetes and obesity. And of course, all of these contribute to premature death. Then we look at the different areas of actions. First of all, policies. We recognize that we have very good international frameworks in terms of human rights conventions, and specifically the UN Conventions on Rights of Persons with Disabilities, and also the UN Conventions on the Right of the Child. And here, what they say is that we need to improve policies to address discrimination, promote equity and equality, enhance participation, promote independence and autonomy, and also facilitate access to care and support. These are the main elements that are highlighted in these international conventions. And when we look at the policies and the different sectors, there are different opportunities to make it happen. I give you a few examples here. For instance, there is a recognized right to live in community and access community-based resources. We know that there is established evidence-based approaches to provide support and evidence-based interventions in communities, also for persons with cerebral palsy. Access to universal health coverage. We know that persons with cerebral palsy and other developmental disabilities have more limited access to regular, what we call universal care, for instance, vaccinations, or receiving care timely for an illness. So this is something that even policies can contribute to changing, to addressing. Looking at the current situation globally, there are some common elements that emerge. We see that there is a lack of coherence in policy across different sectors. There is an inadequate investments in community-based system. And then, even when there is good policy in place, those are often not enforced or implemented or monitored. And these factors contribute to, perpetuating the current situation of having long waiting lists and low access to care, inadequate support during transition. And there are human rights violations also in the context of the health system, including, for instance, with institutionalization or degrading treatments during long stay care provision. And the last message about policies is to highlight what is emerging, on the contrary, as good practice. What are the key elements, key ingredients that emerge as, the really, key aspects that we should advocate for when there is an opportunity to update or to have a new policy in place. So there is the recognition that we want a twin-track approach to policymaking. It means we want to mainstream inclusion of consideration for persons with cerebral palsy and developmental disabilities in all policies. I give an example. There is a new policy being updated on child health and adolescent health. We need to make sure that there is some specific language there and recognition about modalities to address the needs or to make those provisions equitable, relevant to children and adolescents with cerebral palsy. The second aspect is what we call the health in all policies. So recognizing that it is about health, but it is a contribution of many more other sectors, including specifically, the social welfare sector, youth, education. So there is a requirement to look at the environment and what can be done to improve quality of life with the contribution of all these different sectors. And so policies need to be mainstreamed also in these different sectors. Lastly, but not least, it's important that policies reflect the real life concerns of persons with cerebral palsy and developmental disabilities. And for that to happen, we need to actively engage and involve persons with developmental disabilities and their families in policymaking and also in monitoring of policies. The other aspects that the report looked at, and that is a key action, is related to transforming, strengthening care systems, services. Here we look specifically at the health sector, and I want to highlight two aspects here. Again, it's important to reflect on the twin-track approach to care. We want to make available specific services and supports for children, for persons with developmental disabilities and their families. But at the same time, we need to make sure that if there is a health promotion opportunity, if there is a screening being provided, if there is a social emotional learning being provided to young people, that those are provided in a way that they are accessible and that they can equally benefit persons and young persons with cerebral palsy and developmental disabilities. The second aspect I want to highlight is the need to strengthen competencies at all levels. So if we have an opportunity to advocate for improving services in the context of the health system, we need to advocate to improving competencies of nurses, of community-based workers, of specialists, for them not only to be able to assess and manage those conditions, but to provide the range of services that can accompany, that are required across the life course for those children and young people, and also the competencies that can allow them to work together well, to engage the child, to inform the child. Even if the child is having cerebral palsy, equally, there is a right for the child to be informed, to be communicated about his health condition or, the treatment and the care in a modality that is appropriate for the developmental stage and for the age of the child. And similarly with the family, there is abundant evidence about family-centered care and how important it is that care providers are trained on how to engage families in conversations and informing them, empowering them to make choices about care. Then, we look at participation. And again, I'm reflecting on these aspects that are also key actions as emerging from the report. Again, two messages here. Participation is not only about enhancing skills of the person for the person to be able to better participate. It's also about addressing barriers in the environment. We looked across the life course to recognize, for instance, the need to enhance, of course, opportunities to be included in education, how to make sure that children with cerebral palsy, and with communication difficulties, motor impairments, are being supported with technical devices as well as, tailored education strategies to fully benefit from the education setting and education and learning opportunities. And then also in the context of employment, how we can ensure that the young person is receiving training to enhance skills for transition to employment, but also, how to implement supported employment programs, provide coaching within the employment environment, as well as train employers and make available the conditions to have tailored opportunities for inclusion for persons with cerebral palsy and other developmental conditions. I won't go into the detail about public health monitoring, but we need to recognize that, as we mentioned, it's not only, a requirement that we take actions, and we ask governments to take actions to improve policies and to improve services. We need to make sure there is a system in place to monitor, to make governments and other stakeholders accountable for what is being done. And again, if we need to articulate two key aspects in terms of outputs, those are strengthened healthcare services as well as improved environments. So it's not only about services, it's also about the broader environments in education, in health, in communities, and how this can be changed to support better quality of life and better quality of health for children, young people, and adults with developmental conditions and cerebral palsy. The last slide provides a summary of what I mentioned as key areas of action. It articulates the most important key area of actions as in 10 bullet points on 10 areas. So the first one is strengthening coordination, accountability. We need to deepen commitments at all levels, including financial commitment, to make this change happen. We want to promote participation and engagement of persons with cerebral palsy and developmental disabilities and lived experience, also caregivers, in advocacy, leadership, policy, programming, and monitor. We need to address the social determinants of health. So we mentioned poverty, violence, discrimination. We need to address also those ones with policies. We want to strengthen policymaking with a multi-sectorial type of approach, strengthen services to provide people-centered evidence-based care. And we mentioned that we need to enhance the competencies of different people providing services at different levels to make it happen. We want to address stigma and foster inclusion, empower and support caregivers. And we need to strengthen data and research to better account for this, to better inform action and enhance accountability. And finally, we also learn about the importance of being prepared for emergencies and making sure that consideration for persons with cerebral palsy and developmental disabilities are included in plans and protocols for emergencies. Thank you very much for this opportunity, and I'm looking forward to learning from you.